No one should be harmed in healthcare, but about 134 million adverse events occur each year due to unsafe care in hospitals in low and medium income countries, contributing to 2.6 million deaths annually. Today is World Patient Safety Day, and it aims to increase public awareness and engagement and spur global solidarity in action to promote patient safety. Health worker safety, a priority for patient safety, is the theme for this commemoration. Well, joining me from Abuja is Ehi Iden, Ambassador Patient Safety Movement Foundation. Good morning and thank you for joining us on TVC Breakfast.
Good morning. It feels so good to be here.
All right. Now, help us understand the context which the theme for this year is focusing on. It's talking about health worker safety, a priority for patient safety, and it's focusing on the interrelationship between health worker safety and patient safety. Help us better understand this interrelationship, especially in a pandemic that we are facing at this time.
Okay, thank you so much. Before now, all we've always heard about was patient safety and patient safety. But I think in WHO, in their wisdom, realized that patient safety is only an illusion if we do not achieve the healthcare worker safety. There is a strong correlation between the safety of the patient and the safety of the healthcare worker. For us to achieve patient safety, you must first have what you call safe work environment for the healthcare worker. You look at an example of what's happening across many healthcare facilities. As a matter of fact, the hazards that the healthcare worker is exposed to, talking about chemical hazard, biological hazards, and healthcare work environment is highly infectious and prone to diverse level of hazards. So for a healthcare worker to first be able to give out safe treatment outcomes, there's absolute need for the healthcare worker to first be kept safe in the work environment. And take as example issue of work overload. Work overload as an example, which of course has led to huge psychological risk among healthcare workers. Any worker who work extended work hour and get overwhelmed, that stretch, he could make one or two medical errors, and that's an adverse event to the patient. So
all right, let's bring it down to let's bring it down to the pandemic that we are facing at this time. Like I mentioned earlier, a lot of health workers have been forced because of the rise in cases to work long hours. How do we ensure safety at this time? And when we are talking about safety, in what context?
Okay, we're talking about safety majorly on the healthcare worker. So longer hours of work among the healthcare workers, like you saw happening during the pandemic period, it's also drawn from the fact that globally there is shortage of healthcare workers, and now you have healthcare worker to patient ratio is getting so much by the day. So at the end of the day, you find that people are made to work longer hours of work. People even work for about 12 to 16 hours caring for patients, where normally, 8 to 10 hours would have been just appropriate. People are multitasking in the healthcare sector. So in COVID-19, it became so evident. It became so evident that this has become a problem where you have people who were overwhelmed to the extent that a number of healthcare workers had to commit suicide because they just couldn't cope. So I think that was why WHO had to, in their wisdom, had to refocus the goal to look at how do we first keep the healthcare workers safe. One thing we should start advocating for is good healthcare leadership. We need the kind of leadership that can actually address issues of burden of work, issue of emotional stress in the healthcare, issue of overdraw, issue of compassion fatigue, so that we can spread the work hour properly so that the healthcare worker can come to work with the hope that yes, can work appropriately without being exposed to this overdraw, and allow patients that come under his or her care to leave the hospital unharmed or unkilled.
Now, with the peculiarity of the Nigerian situation, if we are to assess this and also address the challenges, where do we begin?
Well, first thing we have to look at, we need a policy change that governs the healthcare sector. What we have right now is not sustainable. If we allow this to continue, we are going to have more healthcare workers working in high hazardous environment and some getting accidentally and killed. Firstly, we need to start reviewing the policy that governs hospital. We need policy makers to rise up to this tough challenge. We need equipment manufacturers to make safe medical equipment. We need healthcare workers, healthcare leadership to institute safe working conditions for healthcare workers. We need the system to be reviewed. We need behavioral change. We need training and retraining of healthcare workers. Example is equipment that are new, that healthcare workers are not used to. We need them to be first trained to know how to use the equipment before they are used on patients. So it's a lot of conglomeration of a whole lot of factors that will lead to healthcare workers' safety. On the long run, we can be achieving patient safety by doing this.
As an ambassador, how have you been engaging perhaps policy makers with regards to these concerns that you have raised?
Okay, one of the things we have done is to start speaking towards a policy review across different countries. Like I am the ambassador in West Africa, so we keep engaging healthcare stakeholders. Like we have a program we've been doing called Patient Safety Dialogue. We bring all the stakeholders into a room and start discussing the real issues in healthcare sector. So at the end of the day, we have a communique we use to discuss with government in seeing what can be done on this issue. And that's why even today also, what we're doing today, we've also been able to bring all the stakeholders, even the policy makers, to a place in Abuja where we are doing the National World Patient Safety Day event. And one of the things we're also opening them to is the state of healthcare in Nigeria currently and the risk that it brings. And at the end of the day, what we will be doing with them, which of course will be so epic, is we are also working with them in doing what you call light up a building. That's one of the campaigns we are doing, and this is where everything is going to be built on in Nigeria. So all the stakeholders are gathered together, and these are the key issues we are doing. One, we also focus on training and retraining the healthcare workers. One of the things we're doing for this year, after the event, is to work with the Nigerian Health and Medical Workers Union, who we are partnering with, to ensure that what is needed to be done in terms of training and capacity building and competency improvement in healthcare as it regards to health and safety is done. So we have those meetings yesterday, and they were very resourceful. And I think in going forward, we are going to marshal out a whole lot of training programs across healthcare sectors in Nigeria.
Now, talk to us basically what factors can actually jeopardize the safety of patients. Can you run us through some of these itemized issues so we can be enlightened?
Okay, thank you so much. One of the key issues that could jeopardize the safety of patients within the circle of care are issues that surround wrong medication. When you have medication error, you have no opportunity to reverse the effect of that medication error, and you leave patient harm. Then we also have issues as surgery site incidences, where you go to do surgery and you get infected at the cost of doing surgery. So where you were caught, there's an infection in that area because of the infection within the healthcare circle, and it takes a whole lot of time to heal. When you should have been spending about 5 days post-operation period, you find out that you are staying up to 2 weeks. You are off work, you are going through inconveniences, and a whole lot of others. You also have issues as injection abscess that happens within the healthcare. You even have issues as slip and fall, even of patients as they come to healthcare facility as a result of the unsafe health facility. A number of issues as healthcare acquired infection. You come in with a primary ailment, and as you're at the point of discharge or leaving, you find out you have an infection, which of course was not what brought you to the hospital. These are called nosocomial infections. So these are all put together and are some of the areas where patients get harmed or get hurt as they come to healthcare facilities.
All right, it's good you have enumerated some of those, and these resonate with a lot of people out there who either have had these experiences here and there. But in ensuring safety for the patient, who really has that responsibility?
It is the responsibility of the facility. That's what we talk about leadership responsibility. Because when we talk about health and safety of the patient, it has to start from the boardroom to the bedside to the security post. And that's why we say healthcare is multidisciplinary. Everyone within the chain has to take responsibility, but we won't look at individual, we look at the system where the patient is being treated. The system take responsibility for whatsoever happened to a patient under their care.
All right, now talk to us about the issue of infrastructure, the kind of buildings and other equipment that are available. How can they jeopardize or compound the issue from the point of designs even to implementation?
Thank you so much, Mike. That's a very brilliant question. There's what you call safety at design. Before you build a hospital, you must sit down and look at what are the safety implications, what are the things I have to put in place so that, one, even the space can be allocated in a way that they can interface properly, they can communicate properly. When we get this wrong, we are already in trouble. I give you an example. You have your theater upstairs, but you have the post operating ward or pre-operating ward downstairs. Yet there is no elevator. Yet there is no ramp. So how do you carry somebody that has back pain injury already or backbone injury and taking that person through the staircase? You will jeopardize that person's case, and the person will become lame forever. Then when you also look at some of the equipment we're using right now, we should not allow anyone who doesn't understand our medical equipment to handle it. I give you an example. In terms you want to do surgery, anesthetics machine are very complicated machine. You are not supposed to bring an outside anesthetist because yours is not available to manage that machine. I have seen cases where anesthetist was brought in to support surgery and the anesthetist overgassed the patient and the heart packed up. Most of these issues are never reported to the relative of the patient what really happened. But I think what we are looking at as of today, when things go wrong, we need to talk about it. When every man is fallible, when things go wrong within that circle of care, we need to talk about it. When we harm a patient, we need to tell the relative what really happened. We need to apologize. We need to own up. Owning up to what really happened gives us an opportunity to learn. So these are some of the areas we are advocating for, to have a just system where we can be free to speak out on real issues as they happen, and let's use that to learn and guide against future occurrence.
All right. Now, one very common occurrence or factor amongst people that we hear them talk about is the issue of self-medication. It is really every day, and it permeates all facets of the society. Talk to us, how does that jeopardize patient safety?
Self-medication most times may not even happen in the hospital. It happens in the patient's home before they get to the hospital, because self-medication is a no-no, which we look at it, because when you self-medicate, you stand the chance of harming yourself. That has nothing to do with hospital. That has to do with the behavior or the choice the patient has made. But what we can do in this regard is to influence government in setting the right policy. That's why I said earlier, we have to start looking at it from the policy perspective. How come we walk into a pharmacy, we can buy medication on our own as we want? I mean, in some countries, you can't find this. But in Nigeria, you find out that we can walk into a pharmacy, walk into a chemist, buy any medication that you want. What you want to do, nobody knows, and this encourages self-medication. But we have the kind of law that will not allow any man to buy medication over the counter or in the pharmacy. This will guide against issues that surround self-medication, which of course lead to high level of mortality as a result of a wrong medical use.
All right. On a day like this, how best can we commemorate a day like this?
Thank you so much, Mike. This is a very good one. What we're doing right now is, in Nigeria, I'm happy that this is happening for the first time, really. We have been able, under the auspices of occupational and safety managers and patient safety movement, have been able to partner with the ITUC and the Medical Health Workers Union. What we're doing today is bringing all the stakeholders together under JOHESU bringing all the leaders in healthcare together to discuss issues as it surrounds not just patient safety, but focusing more on the safety of the healthcare workers. Having achieved this, then we can also be on the pathway of achieving patient safety. So a lot of discussion, conversation has been opened up since yesterday when this program started in Abuja. I'm going back there today. So a lot of conversation has been opened up, training and what is happening across healthcare in the world. Then looking at Nigerian scenario, being able to build a case why we must have the best systems. I give you an example. One of the things we talked about yesterday is having a checklist in healthcare system. If you look at the aviation sector, that's one of the safest transportation sector, and one of the things that have been alluded to why this is like this is because checklist is on the high use in aviation. Why can't we bring this to the healthcare sector? You want to give medication out to a patient, there should be processes you must go through. Tick everything out. This has been met. This has been met. This has been met. By doing this, we are saving the patient. And mind you, when we hurt a patient, it is not just the patient that we have hurt, it is the patient and the family member. So today in Nigeria, we're doing this with all the stakeholders, and in line with what WHO has actually approved, we are also doing the light up building ceremony, which of course we are wearing our orange color t-shirt has been approved by WHO to light up a building, to use that as a Nigerian ceremony for this year. But in going forward after this, we have actually had an MOU yesterday where training begins immediately. Let's look at all the healthcare sectors, all the union, bring that both together and start having the requisite training in ensuring that, yes, what must we do to be safe? The wrong behavior that we see in the healthcare sector by healthcare workers, how do we restrain them from this in achieving patient safety on the long run? So these are the things we began yesterday. The conversation is going to open further afterwards, but we are hoping that at the end of the day, we are able to build a better healthcare system where our relative can go into the system, receive treatment without any fear of getting hurt or killed.
All right, that's really interesting, Ehide. Thank you so much, and let me say happy Patient Safety Day today. Thank you.
Thank you so much.
All right, bye.